after it's over. So it'll be available online. Just reach out to us if you need a copy of it. We've also muted everybody who has joined. So if you have a question or would like to bring up something for discussion throughout the course of this evening, please just use the chat window and we will address it from there. Moving on to the topic for tonight. Over the last 2 weeks or more, our nation has gone from operating normally to emergency planning, emergency protocols, and social distancing for almost all of the population. The state and local governments, as you know, have issued orders which included everything from public venues, park and recreational facilities, and again, the social distancing everywhere we're at. The pace of change and ramifications have been staggering, and for those of us that live in and manage community associations, it has raised many legal questions around situations that have never been contemplated before. So with that will lead us into today's topic, which is COVID-19 and the impacts on our HOAs. So our presenters tonight are Worth Ross, founder and CEO of Worth Ross Management. We have Dean Riddle, the founding shareholder of Riddle and Williams, and Greg Cagle, partner at Cagle and Pugh. So in this webinar tonight, our panelists will share strategies, insights, tools, and resources you can use to support your boards, communities, employees, and residents, especially during this new reality. The overarching topics of today's discussion will be social distancing in community associations, building and unit public access, insurance and litigation risks, association financial impacts, and county and state guidance. As I said earlier, this will be a question and answer format. So you will have the option to submit questions if you would like to. Please, again, just use the chat window on the right side of your screen there, and we will present them when they're contextually appropriate, or we will just save them to the end. So for those of you who have not met tonight's panelists, you're in for a real treat. Our MC for tonight is a man that almost everyone on this call likely knows. That's Worth Ross. So Worth is the founder and CEO of Worth Ross Management Company. He's a graduate at TCU and has more than 30 years of experience serving residential communities. Next, we have Dean Riddle. Dean is a graduate of the University of North Carolina at Chapel Hill. He is the founding shareholder of Riddle and Williams and concentrates his practice on community association law and commercial litigation. Recently, Dean authored the Condominum foreclosure chapter of the State Bar of Texas Foreclosure Manual, and he is board certified in Property Owners Association law. And our third panelist tonight is Gregory Cagle. Greg is a graduate of the Baylor University School of Law, where he was a member of the Order of Barristers and Baylor Law Review. Mr. Cagle is a former briefing attorney to the Honorable Justice Dixon W. Holman in the 2nd District Court of Appeals in Fort Worth. And he is the founding partner of the law firm Cagle Pugh. Before we jump into the conversation tonight, I would like to make the comment that all the information presented on this call should not be interpreted as legal advice for your association. As you all know, associations vary, and any legal opinion should be solicited from your association legal counsel so that the full context and needs of your community as it relates to your governing documents are considered. So with that said, Worth, do you want to get started?
Sure. Thank you very much, Matt. Greg, why don't we start with you? And you know, you won't be surprised, but our first question concerns money. So, assessments are typically the only form of income for associations. Failure to collect assessments, even during these challenging times, could put many associations in a shortfall situation. What options are most important for our boards to consider when it comes to collections and expense management?
There's several things that I would recommend. The first is keep in mind that the economic downturn that's already happened and that will continue to happen as a result of COVID-19 doesn't affect every single owner in the same way. There are going to be owners who are going to suffer some economic impact of it, either through loss of employment, maybe healthcare concerns, issues, costs, but not everybody. We also have lots of people who are getting stimulus money. So as we've been asked a number of times, should the board consider abating or deferring all assessments? And the answer is no. The principal thing of an association is to ensure that it maintains its financial ability to be able to maintain the common elements, to be able to ensure the common elements, and to be able to carry out its functions. And so we strongly recommend that you don't do an across the board abatement or deferral of assessments for that reason. And we still don't know what the impact's going to be. So even to contemplate something like that at this early stage would be a little premature as it is. But what we do recommend is that if you are aware of owners who are suffering from an impact financially from this, work with them on a one-on-one basis. There's a number of things you can do. We think it's a good idea to give them a payment plan if you're not already doing that. If you are doing a payment plan, work with them, maybe give them very liberal payment terms for a short period of time. Anything you can do to keep them paying some amount of money. I'm a big believer that you shouldn't defer all assessments even for one owner, because debt's kind of like a hole, and if you allow somebody not to pay, you're allowing them to dig themselves a hole that someday you're going to ask them to get out of. And the deeper the hole, the more difficult it will be for them to get out of it. So let's keep the shovel short and the hole short. Let's let them sort of mitigate the amount of that hole by getting them on some sort of payment plan, so that when it's time to come out of it, it's not something that's impossible to do. Now, the associations are going to have some people who aren't paying. There will be some people who just don't pay. They can't get out of it. We may see another round of foreclosures like we did back in 2008, 2009. So what can boards do to kind of also, from their side of the ledger, on the expense side, sort of approach it? And I would say, maybe go back and look at some of the contracts, some of the projects you've got going on. If there's a project that you can delay or defer or put off for some time, maybe think about doing that. If it's not an essential repair, think about if there's certain contracts, maybe you don't need all of those services. So if you're suffering an inability to pay your expenses as they come due from a board perspective, you might look at sort of, can you renegotiate some of your contracts? Can you renegotiate some of the services? I would talk to the lawyer for the association first, because not all contracts will allow you to do that. But it may be something you can look at. So you can start to look at your expense side of the ledger by thinking about services that you need or projects that maybe you can put off. From the owner side, I would just work with owners on a one-on-one basis as needed, but I wouldn't do any deferrals or abatements of assessments.
Okay. Great. Thank you very much, Greg. Dean, your question. Over the last few weeks, we've experienced significant challenges to the way we manage and operate community associations. From a legal standpoint, what authority does the board have when it comes to permitting guests or service workers or contractors in the owner's unit and common area elements? And what requirements, if any, can we enforce when it comes to personal protection equipment for these people that are entering the building?
Oh, a lot to that question. First, thanks so much for having Greg and I participate in this webinar. It's a real pleasure to work with you, Worth. And Greg, it's a real pleasure to see you and work with you again. I think we're going to have fun. Let me make a disclaimer, maybe several disclaimers, for those that joined us later. I have a lot of cats in this house, and I am right now fighting off cat hair from a couple of visits I've already had. So please forgive me. There may be more kitty cat visits, and we'll hopefully not have to deal with it, but I just wanted to get that disclaimer out of the way. The second disclaimer is related more to how Greg and I answer questions. And we're giving answers to general questions to provide general guidance. You cannot take our answer and apply any circumstance you've got, because whatever situation you're facing with respect to whatever general question may get asked may have a specific fact that we don't have that may totally change what our answers would be. So on behalf of Greg and I, we ask that you run whatever question you have specifically by your legal counsel to make sure we're not giving you bad guidance. And the last thing is, Greg and I have to be very careful in how we answer questions, because it's possible that we may answer a question and we're doing the best we can to give general advice to people, that in a deposition later on, 6 months from now, or a year from now, because this is getting recorded, is used against us. I've had things like that happen before in the past one time. I don't want to have it happen again. So keep that in mind. We're going to be careful with how we answer questions and try to give you general guidance and recommendations. With respect to answering the question, very good question, loaded with a lot of legal issues, Worth. First, I'd like to start by mentioning something when you talk about what can an association do to enforce enforcement rights. We talk about, one, does the association have rulemaking authority? First thing. And second, gee, can the association even enforce it? And so we're talking about how to control maybe social guests to a condominium, contractors coming in a condominium, access by owners to common areas, social distancing, loaded with a lot of issues. So let's think about number one, associations' ability to make a rule. A lot of associations, whether it's a condominium or a homeowners association, can look in their articles of incorporation or certificate of formation and find some authority. Association may exist to protect the welfare, safety, and residence of the welfare, safety, and health, well-being of the residents. That might get you some rulemaking authority. Rulemaking authority with respect to the issues we're facing with COVID-19 that might perhaps control over the governor's order and the local county orders that have been issued lately? I don't think so. I hesitate with that. More importantly, enforcement. One thing I've always said is, please do not make a rule that you really, practically speaking or legally speaking, can't enforce. So I'm a proponent of not trying to enforce any of these rules with respect to contractors coming, social guests, and let's break that down a moment. Under the Dallas County order signed by Clay Jenkins, it keeps getting amended. Contractors that are performing elective work, like a remodel that's not making the unit habitable, they're not supposed to be coming. Contractors that are performing a service like providing electricity and plumbing and water, oh, they better be able to come in because that makes the unit habitable. How do we know when we're trying to determine who's permitted and who's not permitted to come into a unit? It's too difficult of a call for a management company or board to try to make. Let's let the authorities deal with enforcement on that. So I'm not a proponent of that. What can the association do then? We don't want social guests coming into a high-rise condo. Again, you don't know if that person coming in is a social guest or if there's somebody providing an essential service, maybe bringing medical supplies, prescription drugs, or a family member that's coming to drop off some other necessary items. So again, difficult to enforce. I don't want to enforce. What can we do? Well, the association could provide helpful guidelines, such as when you're on the common elements, maybe you post a sign or send a notice out that says when you're riding elevators, it's a common area, only one person or one household in the elevator at a time. Remind people, when you're using the common areas, please respect people's social distancing and try to remain more than 6 feet away. Things like that. Notices to people that would suggest everyone you come in contact with in the condominium, you should assume has the virus. Every elevator button, every doorknob in the condominium, you should assume it contains the virus. So take those kind of precautions. And then I always like to have disclaimers in whatever notice we have, such as, hey, understand, we can't protect you from contracting this coronavirus. You need to take responsibility and do everything you can do to protect yourself. Give us some liability. And don't ever have a problem with an association communicating helpful thoughts and helpful guidelines to the community. But again, I'm going to see if this works here. Again, we don't want to
see. In recent weeks, we've noticed an increase in requests to open amenity spaces such as gyms and pools, conference rooms, etc. From a legal perspective, do you have concern with the board's exercising business judgment and keeping amenities such as those closed through the duration of this pandemic?
I don't, and I don't for a couple of reasons. If it's common elements, Chapter 82 says the board of directors gets to exercise control and enforce rules and regulations regarding common elements unless your declaration says otherwise. And it's rare that you ever see a set of declarations that says unit owners' rights to use common elements, especially in a condominium, override any rules or regulations adopted by the board. So I think the boards have the power to do it. Similarly, with subdivision developments, you'll sometimes see language giving owners the right to use common areas that are owned by the association, but the association is the owner of those common area amenities, have rights to adopt rules and regulations, and that's also usually vested in the declaration itself. So the associations have the right to adopt rules and regulations, and as long as they're doing so reasonably, that's not going to be challenged or not successfully challenged. So let's just say it that way. We're facing unprecedented pandemic that none of us have ever seen in our lifetimes. We've got worldwide and national disasters declared. We have shelter-in-place orders that are on an unprecedented level. And so for somebody to say, we think it's a reasonable exercise of our authority to close these things down to help prevent the spread of a disease, I think is well within their ability to do so.
Okay, great. Thank you. Thank you. Dean, whenever we encounter events such as a natural disaster, or in this case, a pandemic, there's a potential for lawsuits after the event. When this happens, we often look back and ask ourselves, well, what could we have done differently to mitigate the association's risk? What steps can an association take today to identify those risks and mitigate through best practices with the management and insurance?
Most important thing right now is what we've already done getting to this point. We want to make sure we've got proper and adequate insurance in place. General liability insurance, directors and officers liability insurance, fidelity bond insurance. Make sure we've got the proper insurance in place now, because we never know when we're going to get sued, even when we don't do anything wrong. We have a lot of lawyers out there. When we get to the end of this thing and we come out the other side of this crisis, they're going to be looking for work, and they're going to be filing lawsuits. Insurance is our very first defense. It's the first step. So for the most part, we've hopefully already done what we need to do. But it raises good questions for what we can be thinking about when we do come out on the other side of this thing. I think the most important thing, as I already talked about in the answer to the first question, gosh, let's don't step in it by trying to make a rule that we can't enforce. Because you make a rule, you don't enforce it, then you can be sued for unsuccessful or ineffective enforcement of the rule. The second thing is, we want to provide helpful guidance and helpful information to all of our residents. To the extent we do that and educate them, it's less likely we'll make someone mad, and it's less likely we'll give them cause for a claim that can support a viable lawsuit. Third thing is, and I mentioned this in the first answer, sending periodic notices to owners, keeping them informed of helpful information and good guidance. Listen to your residents is one of the last things we can do. We want to be open-minded. We want to have our ears open. We want to be transparent with people, all the residents. And we want to boards and management work together to communicate and be transparent with all of our residents. And lastly, when we come out on the other side of this thing, we probably ought to schedule the board and management company a meeting with our insurance agents to make sure there's not some other type of insurance that we could get to accommodate a need for a defense if we encounter some sort of suit that we didn't have any idea could ever be conjured up by some plaintiff's attorney. No offense to the plaintiff's attorney. I like being on the plaintiff's side more than I do the defendant's side sometimes. Thanks, Worth. Thanks for that good question.
All right. Thank you, Dean. Greg, we are facing unique circumstances with residents sheltering in place. Many communities have developed extensive COVID-19 protocols to mitigate exposure, but we're not seeing compliance in everyone. Can you speak to the best procedure for handling routine violations as opposed to COVID-19 violations? What recourse does an association have as it relates to a violation of the COVID-19 protocols? For example, can we require a resident to self-quarantine if they have been exposed or if they've been traveling from a hotspot?
Those are really good questions, Worth. I think the thing that everybody should keep in mind is that property owners associations are not public health agencies. They're not police agencies. They're not governmental entities. We're not here to enforce state regulations, public health orders. That's just not the role of an association. The association's not suited to do that. It doesn't have the same enforcement mechanisms. It just doesn't have that. So when we think about the COVID-19 protocols that are being issued by our counties, cities, state, and even national governmental agencies, those are separate and apart from the role of the association, and they're not really enforceable by the association. So what I would say is, if you see owners or guests that are violating existing COVID-19 protocols issued by the city or the county, then your only real option at that point is to report it to those public health agencies so that they can take appropriate steps. If there is somebody who's been a confirmed diagnosis of COVID-19 and they're required to self-quarantine and they're not, you should report that to the public health agency so that they can take appropriate remediation of that. It's not something that the association should do. But also, when you asked about what about non-COVID-19 violations of the rules or of the restrictive covenants, what should we do about that, or what's the protocol or the approach we should take? We're asking owners, we're not asking them to, but we've got owners who are either being asked to or being ordered to self-quarantine. We've got people who are taking and doing things that they would not normally do, working from home, for instance. So we may see people, if you've got quotas, on the number of people who can occupy a unit, you may have more people in there. We've got people who might be if it's a subdivision, bringing more cars home or work equipment for some reason. They might not be mowing their yard. There's a number of things that might be happening. And what I would say is take a common sense approach. Recognize that we're in an unprecedented time period. There's a little bit of grayness to what's going on and how people are reacting to it. So I would take it with a common sense approach, as long as it's not having an effect on other units or a safety issue for the other units or the association. I would take a little bit more of a lax approach to it and give some people benefit of the doubt, and also take a common sense approach to it, in that they might be trying to self-quarantine, which means maybe they're not taking their trash to the trash chute or something else. So that's how I would approach it. But if it's a COVID-19 issue, we're not a state agency. I would refer those to the correct public health agencies to deal with.
Okay, all right. Thank you, Greg. Dean, with the number of cases increasing, the possibility of a positive case within one of our communities remains. In fact, we've had some. In the event the board or management company receives confirmation of a positive case, what steps, if any, should we be taking to advise the residents living there? I think this applies, Dean, more to the high-rise situation than in a lot and block situation.
And we've actually had this come up in more than one instance. I agree with Greg. I don't think it is the association's role to enforce a self-quarantine. Just, I don't think it is. And I think that if the association wants to do anything, and I'm not recommending you do this, but there are boards that feel like they want to take a more aggressive approach than other boards. If the board wants to send any kind of notification out, and again, I don't think they try to enforce it. If someone that tested positive is coming out of their unit, report it to the authorities. The Dallas police would be a good place to start. But again, with a notification to the owners, I think you could consider notifying the owners that we have had a resident or residents that have tested positive. We're not going to share with you their names or their location or address, but be aware that we do have positive cases. Therefore, when you're in the common area, common elements, treat everyone as if they are infected. Treat all areas you touch as if they're infected, such as maybe trash areas or shared laundry facilities, in addition to elevators. Do that, and I think that's enough to protect yourself. But the bottom line, the association is not required to enforce it. They're not equipped to enforce it. Think about how you enforce it. That might create a violation of the 6-foot social distancing rule, as well as give the virus a great opportunity to jump from one person to another. You may have a confrontation, a physical confrontation, as a result of trying to enforce it. So absolutely don't enforce that. Stay out. Let the public authorities enforce it.
Okay, great. Thank
Good
you.
question, though.
Well, you know, we've had this in several of our buildings already. So
I mean, back 20 years ago, I might have been the dummy that goes out and tries to enforce it. I'm not like that anymore, Worth. I'm a lot less aggressive.
I'm with you. I'm with you. Greg, in the most recent recommendation from the CDC and requirements in several cities that we do business in, it's the use of masks in public spaces where social distancing is not possible, like public transit or in our elevators. Should associations be considering the adoption of a policy that makes it a requirement in common spaces where social distancing is not possible, like hallways? And if it is, if the boards can require that, how do we effectively manage and enforce it?
So I think, and Dean has kind of touched on this in a couple of instances about adopting rules that aren't really enforceable. And it kind of also segues back into CDC recommendations are not really orders. I know the city of Austin, city of San Antonio have issued actual orders now requiring people in public places to have masks. But the reality is, and I'm really speaking about condominiums here, common element hallways are not public facilities. They're not open to the public. That's why they're not typically subject to the ADA. They're not a public area. And so these municipal orders ordering people to have a mask on are not going to actually apply in the hallways. And I don't think, for the reasons we've talked about, the association is really not a public health agency. It's not a governmental agency. It's not really capable of shoving somebody back into their unit and making them self-quarantine. It's also not really, they're not really able to require people to wear masks. You can recommend it. You can pass on the CDC recommendations. The board could make masks available to people who don't have them if they would like to wear them. But I don't think you can require it, and I don't know how you would enforce it.
Okay, all right, thank you. Dean, in recent weeks, we've noticed an increase in requests to open amenity spaces, such as the gym, pools, conference rooms, et cetera. From a legal perspective, do you have concern with boards exercising business judgment and keeping amenities closed through the duration of the pandemic?
I don't have a problem with that. I see that as common elements. The board of directors has the power under Chapter 82 of the Uniform Condominium Act, as well as most bylaws and declarations, to control use of common elements, swimming pools. Anywhere like swimming pools where you have handles and bathrooms, that's a petri dish for this virus. So I see this as the board of directors' opportunity to do something in addition to what the local governments, the county governments, the state governments, and the federal government are trying to do to control this coronavirus. So I don't have a problem with it. I hate that we're having to take those draconian measures, and I understand why owners would be upset. But if the condominium boards and the other homeowner association boards and community boards don't follow the lead that our county leaders and our state leaders are providing, I think we're simply setting ourselves up for potential, I say potential liability in the future with respect to lawsuits. Now, I got to say this. I don't know how anyone could prove that some plaintiff contracted this coronavirus from this specific instance or that specific instance versus something else in their life. I don't know. I haven't figured that out yet. We'll leave that to the really smart plaintiff's attorneys. But I do, yeah, yes, oxymoron, right? Talking about myself. I just don't have a problem with it. I think that a good guideline, I could be wrong, guys. I'm not always right. I just throw this out there. A good guideline for when we might want to consider reopening the gym. And I got to say, man, the gym, that's the biggest petri dish in the world. I miss having my gym. I know you do too, Worth. We miss our gyms. But I can deal with missing the gym for 8 weeks, maybe a little bit more, not much more than that, in exchange for not subjecting myself to the risk of catching this virus. I don't want this thing. But I think a good rule of thumb is when we see the governor or in Dallas County, Clay Jenkins saying it's okay to open the gyms and go to the gyms, then I think we can feel good about opening back up our gyms and our swimming pools. Just a rule of thumb. It's not going to be the same answer for everybody.
Right. Okay.
But let me raise this question because I thought about this. It's kind of interesting. We have Clay Jenkins' order that expressly says that hiking, biking, and outdoor activities are essential activities. Most pools are outside. So think about this. Why is swimming, I'm not saying gatherings or congregations of people, why is swimming in a pool as an outdoor activity any different than hiking, biking, or cycling? Governor Abbott's executive order also recognizes that people have the right to hike and bike. I think the difference is the fact you've got so many railings on the pool, you've got gates to open and close going in the pool, and anytime you're around the pool, you've got pool furniture and people congregate. So I think it's okay. I thought through it. I think that there is a difference between swimming pools and the hiking and biking and running and jogging and things like that. Those outdoor activities that both the local orders and the governor's orders have said it's okay to take part in those kinds of activities. So I think it's okay. Now, for our communities that have lakes in them, I don't know that I would want a board of directors to close down access to a dock. I haven't thought through it all the way yet. I haven't been given that question yet. But fishing is one of those activities that the governor recognizes as something people should be able to do. So when it comes to marina access and things like that, I think that's a different category from swimming pools.
Right.
Could be wrong. Don't know, but just think about that.
Okay.
Boards need to think about things, in depth and talk to their lawyer before they make a decision.
Okay.
God, I was long-winded, wasn't I? Oh, it's awful. Get a muzzle.
All right, Greg, you're up. When it comes to essential services within the association, there could be endless possibilities of identifying what essential and what is not. How do we, or how do you think the board can best define essential services as it relates to construction and enhancements of common elements or owner improvements in their units and like remodeling?
Well, I would say, first off, the government's kind of already defined for us to some degree what's essential and what's not. And Dean brought it up earlier. Remodels, no. Electrical, plumbing, yes. Anything that has to do with the habitability of a residence, certainly I think would fall within in the essential services. So anything that has to do with an owner or an owner's use of the space for habitability or to something associated with that, I think is important. I think the same thing for common elements for the association. If it's necessary to be serviced for the owners to be able to use it as necessary for their units, then I think that would be an essential service. If it's purely just a remodeling to make it look prettier, I don't know that I would call that an essential service, but I don't think the government would call that an essential service. So I think you just have to look at it from that perspective. I would use what the government has said right now as essential service as sort of a threshold guideline. And then as you get requests from owners, I'd look at it on an ad hoc basis, because those guidelines from the government are broad-based with a broad stroke, and they're not going to apply necessarily to every instance. So I would use it as a base guideline and then look at each instance sort of to see if there's anything unique that would justify making a different decision.
Okay. All right. Thank you. Dean, over the last several weeks, many cities have started placing enhanced restrictions or outright banning short-term rentals in an effort to minimize the spread. These restrictions are coming with some exceptions in that they don't prohibit or they do not prohibit short-term rentals for hospital employees or other licensed healthcare professionals or military personnel or law enforcement or other government employees. In such cases of county residents, or in such cases, county residents need a place to self-quarantine away from their family or roommates. Should association give consideration to permitting short-term rental activity for these exceptions? How would you suggest how should management effectively manage these potential increased demands?
That is a tough and loaded question.
That's why I saved it for you.
Yeah. Oh, boy. The first thing I would do in answering the question for any association that came to me with that is I would need to read, analyze, and evaluate the rental restriction at issue, because the exact language of the rental restriction and how short-term it is would really guide us in what we can and cannot enforce. Okay, so that's the first thing I would do. Now, with respect to the hospital employees and licensed healthcare professionals and military or law enforcement that might want the short-term rental, I would follow whatever county or city ordinance or safe at home order states with respect to that, and they can be different in the different locations. So you're going to need to look at each one, although there are significant similarities between the various ones. They're all copying each other and changing to a certain degree. But I would follow those guidelines. The third thing I want to say about it is I do not think I would want to preclude a hospital or a healthcare professional from getting a rental, even if I've got a proper restriction to enforce, from getting a location that's near to that healthcare professional's location of business. I don't know that I'd want to get drug in court over that. And we all know that leasing and rental restrictions are a hot topic anyway in the state. We've got the legislature looking at restricting how we can restrict and ban and govern leasing. Yep. We've got cities that are trying to do it as well. And so we've got to use a common sense approach to that enforcement. I like Greg's reference to the common sense approach. Every one of these questions, in getting them answered, we should start with that common sense approach. So that's the guidance that I have on that. I wasn't quite as long-winded. I like that answer.
Common sense approach. All right. Thank you, Dean. Greg, what is to be done, if anything, about real estate brokers hosting open houses and conducting real estate showings during this time?
I think that's a tough question, to be honest. Certainly, we don't want to prohibit people from being able to sell their units. I think that's important for the health of a community, that owners who need to be able to sell or wanting to sell, it'll cost them a lot if it has to stay on the market longer because we're obstructing it. So I think going kind of back to a common sense approach is we don't want a lot of people who aren't normally coming into the building and increasing the traffic load and the number of people coming in who might be touching elevator buttons, handles, hallways. So maybe we want to restrict that. Maybe we have a community that has, a higher percentage of folks that are in a high risk category because of their age. So we may, have a board who just as a value decision says, hey, we kind of want to limit the amount of traffic. So I would look at it on a case-by-case basis. If you've got a unit owner who's trying to sell it, maybe talk to them or their broker about can we not do large open houses? Can we limit it for a short period of time to no more than a few people by appointment only? Maybe you can ask them if they'll wear masks or gloves when they come in and they're in the common element hallways. If you've got heightened concerns about it. With the gathering in place restrictions also might serve as a guideline. Is if you're going to have an open house, if there's a way you can limit it to no more than a few people or below that threshold during the open house. We don't want to stop people's ability to be able to sell. It can be, sometimes units will sit on the market for a long time, and we certainly wouldn't want somebody to say that we unlawfully obstructed their ability to legally sell their property and it sat on the market longer. And now you've got sort of a definable damage model potentially. And so I think we want to use common sense, talk to the owner, talk to the real estate agent. But I also, I don't know how many people are out shopping right now, to be honest with you. So I think use common sense, talk to them, see if you can't get them to agree, at least during this time period, to just limit it to by appointment only and just a few people at a time.
Okay, great. Thank you. All right, Dean, we're back to you. So we get a lot of complaints from people who are pointing out one group or another and saying that they're not following social distancing. So what's the association's responsibility in having people correctly social distancing?
Well, I agree with Greg's conclusions about this issue. No, we're not going to enforce that. Okay. First, we don't have the rule. The social distancing is in Dallas County. It is from Clay Jenkins' signature back in early April, or actually late March, and then it kept getting amended, and things kept getting added to it.
Sure.
We can't. So it's not our rule. We do not want to make a rule because we don't want to make a rule we can't enforce, practically speaking, or even doing so in a way that doesn't put us at risk for contracting this virus. So no, and no. We're not going to enforce it.
Great.
Dean,
Okay.
can I interject for 1 second? We have a question from the audience on this topic, so maybe we can expand a little bit.
Sure.
The question is, as it relates to guests or vendors who are visiting the property, can there be an enforcement protocol there as opposed to the residents of the building?
I don't think we should be enforcing that. Again, those are orders coming from the county government. And that order, if you look at Clay Jenkins' order, it states that it is subject to criminal and civil enforcement, basically by the Department of Public Safety. I haven't seen associations listed as being someone that can enforce those orders. Now, there is a question of what does it mean, civil enforcement? That raises an issue about whether somebody could file a lawsuit civilly over it, but I think the answer to that's no. And then, as Greg and I have agreed in our earlier remarks, we don't think we should be making a rule about it or trying to enforce somebody else's order. So I think we stay out of that. If you see things that are suspicious and going on, then call the public safety, call the police. But we can't do that. Plus, you don't know when somebody's coming to a unit, a contractor, or some other guest. Really, if you don't know the nature of their business, and I don't think I would ask. We just want to stay out of enforcing those kinds of things. That's up to our Department of Public Safety and our health officials.
Okay, Matt, I've gone through the questions.
Okay.
So,
yeah, we have another one here. This one is for Greg. So earlier when you had touched on the topic of the question that was related to assessments and deferments, the question that came up around that topic was if an association runs into a situation where there might be an operational shortfall and they have to borrow from reserves, kind of what would the best practice there be in essentially loaning money to themselves?
Well, one, you'll want to look at your declaration. Sometimes reserves are earmarked and are only allowed for certain expenses. So you want to have a discussion with the attorney for the association just to look to see if there's any restrictions on the ability of the association to do that. And so I would do that. The second thing is they may have to consider a special assessment if they're unable to use that reserve money, but they need to, shore up an operational shortfall. Hopefully you're seeing that well enough in advance to come up with some other options and be thinking about it. But I think the reserve is certainly an option, but I would be mindful that there may be some restrictions on your ability to use it that I would just want to be careful about.
Okay, thank you. The next one, this is, I believe Dean answered this question. It was the one related to kind of wishing we would have done things differently 6 months from now. The question is, what type of lawsuits might you anticipate coming from this scenario that the association can be prepared for?
Well, depending on what you do, we could face a lawsuit over a unit not selling if we have placed some rules or tried to enforce some rules. For example, if someone's trying to sell a unit, we could face a lawsuit from a seller who wasn't able to sell. We could also face a lawsuit from a buyer who was wanting to move into a unit but was precluded from moving into it, which I do not recommend you do. Moving is an essential service. If somebody gets a home, wants to move in, you're going to have to allow them to move in. You can try to help them with some rules on hours on moving in, but you have to let them move in. You could face a suit from a buyer and owner over that. You could also face a suit from a renter that was wanting to rent and that was precluded. Now, all of those people may ultimately lose, but the question was, what kind of suits could you face? I guess it's also entirely plausible that you could face a lawsuit. Let's assume that a manager in a building had contracted coronavirus. and a worker working with the manager also contracted it. You could see the management company potentially facing liability. Hey guys, I'm giving this answer. I'm not trying to give anybody any ideas, okay? I'm just being realistic with what we've got facing us. You could also face a potential lawsuit from an owner who contracted the virus from someone they got on an elevator with that tested positive, and the association didn't notify people about it. I ain't a bad lawsuit. It's not our job to notify people about it. That's also plausible. There could also be some business lawsuits filed over it. You could have a contractor that blames an association for not being able to perform work in a home or a condominium. It has nothing to do with what the association did. They're just going to sue anybody and everybody over the fact that they lost money because they couldn't complete a remodel. Who knows? And I can go on and on and on. There's no way I can possibly think as broadly as some of our wise plaintiffs' attorneys out there.
All right, thank you. Greg, this next one is for you. So this one goes back to the question that you had addressed related to opening up amenity spaces and the increased pressure that some of us have had this week related to that topic. So I think there's a lot of people who are hopeful that more public spaces are open in the not too distant future. So the question is, do associations have the ability to be more stringent than the public is with their opening?
Yes, I think they do. I think ultimately they have the right to regulate the use of those common elements, and I think as long as they're being reasonable, those are going to be enforceable. There's a number of issues. If you open them up, it means that your staff, the management staff, might have to go in there and clean up, which means they're getting exposed more, which may be a problem with keeping your building staff. It increases the number of areas that need to be cleaned on a regular, routine basis to prevent the spread of it. The spread of it in a building can have an effect on other unit owners' ability to pay. There's a number of reasons that you could easily justify a board deciding, they want to keep it shut. Maybe we talked about earlier, that maybe you have a population of residents that are more susceptible to COVID-19. And so there's a number of reasons why you might want to do it. So I think if this board wants to do it, I think they have the right to do it. And I think it would be hard pressed given this unprecedented pandemic with unprecedented governmental shutdowns of businesses, ordering people to stay home, that no judge is going to second guess a board's decision to do what they thought was right to help spread or help prevent the spread of this disease and to keep their building safe. So if the board wants to do it, I think that they're going to be justified in doing it. If they want to open it up, I think they can do that as well because they're not a health organization. These are private amenities, not public amenities. And so I think it's ultimately a value decision by boards, but I think it's a good idea to shut them down, not just for the safety of their unit owners and residents, but also for the management staff.
All right, thank you. Thanks, Greg. We have another question. So Dean, this one's for you because it relates to a question you have already answered as well. So does the HOA have a right to access a residence unit in order to complete an essential project? As an example, maybe a fire alarm upgrade. So this assumes denial of access could cost the association more money or delay completion of the project, which also could cost the association more money. And this obviously assumes that resident is sensitive to the COVID-19 situation.
Yes. That the question assumes a fact that this is an essential repair work that needs to be done that relates to health, safety, and welfare. And so, yes, the association does, under the Uniform Condominium Act, have a right to access with notice to the owner. I think that what might help in getting this done, guess what? The owner's going to say, you're not coming in. You ain't coming in my unit, all right? There's no way you're coming in. Well, we have the right to come in. It's health, safety, and welfare issue. So we go in. I think that we can require that the contractors that are doing the work, everybody that enters, maintain the social distance. I think we can ask them to wear masks and wear gloves. And we might even ask the unit owners to kind of isolate in a separate room, a separate part that's away from where the work's being done, or maybe even be gone from the unit and come back after the work is done, assuming it can be done in a few hours or a day. But in answering the question, yes, the association does have the right to get in and make essential repair work.
So would there then in turn be an obligation for the association to disinfect, sanitize?
I don't know that it's the association's obligation. We might require the contractor to do that, but the association could also come back in and do a second round just to be safe. It's a difficult question, but we've actually faced similar issues like that already.
Okay. Well, we're running right up against 6 o'clock, and there's no other questions from the attendees. So is there anything else from Worth, Greg, Dean?
No, I just think that I just think that we all need to be prepared for. I think we need to be prepared for improvising. I mean, we're to a certain degree. A month ago, when we had questions, we're kind of doing the best we can to research things and shoot as quickly as we can. We're not shooting from the hip, but we're doing the best we can in, as Greg put it, an unprecedented time where we're making almost split-second decisions and guessing to a certain degree.
Okay. We have 2 minutes, and another question came in. Greg, if you want to answer this one, as it relates to move-ins, what about? So it's related to move-ins and move-outs. So what about concerns around that situation? Outsiders coming in and out of the building frequently, and the liability associated with that.
I think Dean sort of addressed it, but I'll reiterate. You're not going to be able to prevent tenants from moving in and out. I don't think you can do that. I certainly don't think you should be doing that. We have some normal rules oftentimes with move-ins and move-outs. You've got to put up padding around the elevator. You've got to maybe sometimes put the protective boards on the floor. So there's certain things we do to prevent damage to the building. You could always ask the moving company, the tenants, to have their movers wear masks and gloves. I don't know that you can require it. You could always certainly ask for it. And so if you're concerned about it, that's what I would do. I've seen that lots of vendors that are still operating, they care about their own employees as well. They know their employees are going into buildings, and they do care about their employees. And the vendors that I've dealt with, not only are they amenable when we ask them, they're already doing it. Because if their employees get sick, and their employees are putting themselves out there by going into lots of different buildings that they don't know whether they've been cleaned, they don't know whether there's anybody who's been who's tested positive, they're trying to keep their employees safe as well. So I think it's an easy ask, and I think you'll find that most of the vendors are doing it anyway.
All right. Thank you. So that takes us right up to 6 o'clock. So Worth, Greg, and Dean, thank you all very much for participating in this. Everyone who called in and joined via video or phone call, we appreciate it. We would love feedback. And again, as I said when we got started, we have recorded this, so a video is available. Should you want it to reference back for anything, just let us know. And if there's nothing else, thanks everybody for attending, and we will see you all again soon.
Great job, guys.
Thank you. We enjoyed it. Greg, good to see you. Worth, good to see you. Good to see everybody.
Likewise. Take care, everybody.
See you again.
Thank you.